Dr. Sanjeev Bagai joins us on this broadcast, Chairman and National IMA COVID Task Force, and the past President of the Indian Medical Association, Dr. Rajeev Jayadevan, also join us on this broadcast. Thank you so much for taking out time and sharing your expertise, both you gentlemen. Dr. Jayadevan, I'd like to begin with you. As far as the origin of COVID and China is concerned, many scientists from China have also said that it was an accident that the world had to pay for. It was a lab-made virus, and the price for which the world was paying. Then we had a zero COVID policy that was in place in China for over 2.5 years. The minute those restrictions were lifted, we see absolute mayhem and chaos.
Yes, China had continued what is called a dynamic zero COVID policy, in contrast with most developed nations, with a few exceptions. But the good side of that, if there is such a thing, is that in the past 2.5 years, the number of deaths in China have been so low, several hundredfold low adjusted for population. But the flip side of this policy is that in spite of China's vaccination policies, the lack of spread of this virus in the community has led to what can be called a deficiency in naturally acquired immunity. Now, we're not endorsing that people should get infected to get immune. But as a natural consequence of surviving COVID-19, there is a population-level immunity in countries like India and South Africa, and that, along with vaccination, has kept our death rates low. The concern now is a large unvaccinated segment in the elderly population of China. To talk about numbers, over 1 crore people over the age of 80 are unvaccinated in China. And now that is not a good situation to be in. And these are figures from November. So I know China is rushing to vaccinate people. So the sooner we vaccinate older individuals who've never been vaccinated, the better it is for the country.
But Dr. Jayadevan, why do you think that we've reached such a situation where one of the epidemiologists actually had to come out and sound an alarm that there could be millions of deaths in the near future? Do you think it's just a doomsday prophecy, or that is a situation that China could be facing in the near future?
This was always known. In fact, if you look at the Chinese government officials' official articles, they have always said that their policy is every life matters, is what they said. They do not want even one death from COVID-19 from spreading. So from that standpoint, they were banking on the strategy to continue, but studies had already been there and quoted by the same officials that they expect approximately 1.5 million deaths, or some studies say 1 million deaths, could occur if the virus were allowed to run free in that country of 1.4 billion people. So they always knew this, but I think if you look at their vaccination strategy, they started at the younger age groups compared to, in contrast to India and other nations. We started with older age groups. China started with younger age groups, but they ran into problems vaccinating their older people. They were not willing to accept the vaccine. So that has been the problem there. But they have added other vaccines like nasal vaccines, and I believe that they are attempting to vaccinate everyone by end of January, according to reports.
Right, and Dr. Bagai, there are several reasons why we're seeing this kind of surge in COVID-19 cases in China, like Dr. Jayadevan was also pointing out. Because they've been in a zero COVID policy for the last 2.5 years, the concept of a herd immunity didn't exist. The efficacy of their vaccine, I beg your pardon, is also something that there are questions that are being raised over that. Now, can the Chinese government escape accountability? They tried to do so when they suppressed the facts back when at the outbreak of the pandemic. They seem to be continuing to do so now. But can they actually escape that kind of accountability?
Good evening. I think the entire edifice of the China's vaccination strategy, and indeed their society at large, is based on a false narrative. It's just laden with lies. No one knows the true data. No one knows the true facts which are coming out of China, which is extremely unfortunate. So let's put facts on the table. The vaccine efficacy, even for the original strain of SARS-CoV-2 of the Chinese-made vaccines, was extremely poor, bordering between 30 to 50%. Now with the Omicron sublineages, which are more than 620 different sublineages, the efficacy is down to below 20% in most studies. In a multi-centric trial collaborative data of Cochrane, it's about 20-odd%. This is extremely low because the new sublineages have a higher vaccine escape They have a higher immune escape. There are different concepts now of immune, what we call as low hybrid immunity, because they don't have a natural community immunity. And there is immune imprinting. That means your receptor binding domain is behaving differently. Now, with the given scenario of a large segment of population locked up for months together and years together, not being exposed to any infection at all, they are suddenly exposing a partially unvaccinated community with comorbidities, without any boosters, of course, to now the rampaging sublineages, which are more contagious, more lethal, and more invasive, with a higher affinity binding to the host cell. So this is not spelling good for China. They need to see reason not to protect their own share, but to protect lives. They need a better brand and a better platform of vaccines. They need to protect the elderly, vulnerables, and comorbid patients immediately. They need at least a window period of 3 months before the efficacy of the newer vaccines kicks in into a large community. They cannot rely on their lives, because if this virus spreads out again, we are back to square one of 2020. The world cannot tolerate this.
Absolutely. And we've seen how it's not just in China, but it's spreading across other countries in the world as well. Dr. Jayadevan always knew that there would be new variants that would keep coming. This virus is such that it would keep evolving, and it was an unknown enemy that we were fighting for the longest time. Now, with this new variant that is wreaking havoc in China, how does that impact other countries of the world? Should an alarm be sounded, or is this going to be restricted only to China because of the kind of policies or the inefficient vaccines that they've had?
Yes, all over the world, COVID is showing a cyclical tendency, and in Western nations, it is now winter time, and they are having a surge at this time. It is not a massive surge. It's not like it's overwhelming them, but the number of cases are going up in Western nations. Now, the Chinese situation goes, the mortality or the death rate of Omicron and its sublineages is far lower than that of last year, that of Delta. If Delta had been allowed to spread in that country, the death count would be far higher. So in one sense, they are now dealing with a less lethal variant, if you will. Omicron, as we know, does not cause so much of lung damage as Delta did last year. We all saw what it did in various countries, including ours.
Yes.
But now with Omicron sublineages, if these sublineages evolve into something more, let's say, biologically different, if you will, say if it causes more severe disease, those are some theoretical possibilities that are always been faced by scientists. That is always a possibility. The more the virus spreads, clearly, the more chances it gets to mutate. And particularly so when it gets to infect people with certain immune suppressed conditions over a period of several months. Now, this is a situation where a new variant, an all new variant, completely different from Omicron, could potentially emerge. And we hope that that will not happen. And if that happens, we will hope that it will be less severe than the existing variants.
Sure.
But we can hope all we want, but the virus does not follow a human narrative.
Absolutely. But for China to make amends, they actually will have to come out and accept the fact that there were shortcomings in their policy. And that's something we perhaps cannot accept from the Chinese administration. But I thank you both doctors for joining us here on this broadcast with your perspective. We will keep a close watch on the developments in China and the fallout it would have on the world. But for now, shifting focus to more news coming in. Epidemiologist and health economist, hospitals are completely overwhelmed in China. He also shared some videos on social media and estimated that more than 60% of China and 10% of the Earth's population is likely to be infected over the next 90 days. He also projected death of millions of people. Now, as per reports, one of Beijing's designated crematoriums for COVID-19 patients has been flooded with dead bodies in the recent past. This epidemiologist also revealed that funerals are taking place in Beijing 24/7 and over 2,000 bodies are backlogged. Meanwhile, the World Bank has slashed China's growth forecast for the year as pandemic and weaknesses in the property sector has hit the world's second largest economy. So for a country that was facing allegations of ensuring the spread of COVID-19 by suppressing the truth 2 years ago, is now facing allegations of once again letting the situation go out of hand.